My name is Charlotte. I am 23 years old and I live in West Valley, Utah. I have 3 children. I have 2 little boys and a little girl. I have a 6-year-old, a 4-year-old, and a 1-year-old. My boys are my oldest. My boys are boys, definitely, full boy. Climbing the fences, wrestling the dogs. It's what they do. My little girl's following in their footsteps because she's the youngest, so. My story is a little different than everybody else's. I have had my vascular malformation since I was technically born. A vascular malformation is a mass of blood cells, just like your veins that you have through your body anyway. Like when you prick your finger, you bleed. It's a bunch of little ones of those that is just combined together. Mine is a mass large enough that it has attached itself into my muscle in my thigh and into my femur bone. I contacted another physician at a different clinic and he did an MRI, and when he saw the complexity of my malformation, he wasn't comfortable treating me. So he referred me to Dr. Frodsham.
So Charlotte's a very lovely young lady that I met through our vascular clinic. In her particular scenario, she's had this really large, complex venous malformation above her knee. And it's actually invading the muscles and going into the bone, and it's large, painful, and it's been there for as long as she can remember. You know, these have a tendency to slowly grow over time, and it's got bigger and bigger to where it's become debilitating for her.
Range of motion limitation, swelling, weakness, limited activity abilities. I was way more like self-conscious about my knee because I'd think about something like going hiking. I'd be like, well, I can't do this whole trek because I have to watch my knee. I can't do this unpaved course. I explained to him the scenarios of the other doctor's treatments, how it hurt, I wasn't able to move anymore, the pain medicine wasn't helping even if I took it. I just had a lot of complications after all my procedures, and it was his idea actually to try this other method considering my previous experiences.
In her particular case, we decided to try a little bit different therapy. There's a newer treatment with what we call bleomycin, which essentially causes that whole area to scar down and occlude those vessels. And we've kind of come to the very last few treatments. And interestingly, she said yesterday, I've never been able to see my kneecap in as long as I can remember, and now I can see it again.
It definitely has worked a lot better. I actually have a kneecap again. I haven't seen my kneecap since I was little, because it's normally so swollen. So using his approach, I've been able to get back to my life with my kids. I'm able to go out with them more. I have more freedom, I guess you could say, because my knee doesn't start hurting instantly when I'm up and moving anymore. It is so much better.
Having some of these therapies that actually shrink it down and bring it down to a point where it's no longer causing those symptoms and disability, it's amazing for her. I think she really cared mostly about the function and being able to help her kids and being able to get back to the kind of work she wants to do, which is medical assisting, and you know, that's actually her training and background, and that's what she wants to do.
Being at the end of this is definitely something I wasn't expecting. My other previous doctors told me I would have to deal with this for life, that I wouldn't have any freedom from it. I'd constantly just have to go through procedures and constantly in the hospital and being on pain medications. And now that Dr. Frodsham has given me that freedom, it's just freeing. I don't have that weight on my shoulders anymore.